Hi, my name is Manuel Cruz, and this is my video submission for my analysis of the management case study for Partners Healthcare. Before going into my analysis, I'd like to discuss what is management? Management is explained in the textbook as the process of getting things done and work done through people. I'd like to point out that management and leadership are two different things. A manager is not always a leader, and a leader is not necessarily a manager. The key difference between the two is that a manager is responsible for much more technical components in organizing the team, whereas a leader is much less formal, but is very crucial for motivating and getting people and leading the group. Management can be broken down into 5 components as described by Luther Gulick and Lyndall Erwick. These 5 components are planning, organizing, staffing, directing, and controlling. To quickly discuss each different component, planning refers to what to do and how to do it. A key factor in planning for your team refers to establishing a mission statement, goals, objectives, strategies, and methods for accomplishing what you're trying to do. Next is organizing. Organizing refers to the arrangement of work into jobs and/or departments. A very important responsibility in organizing is developing an organization chart. Staffing refers to obtaining and retaining people for the work. It's important to note that retaining is just as important as recruiting employees, because what's the point of getting more employees if they're not going to stay, right? This also includes recruiting, training, and orienting new staff. Fourth is directing. This refers to assigning work to people and motivating them to get that work done. And lastly is controlling. Controlling refers to comparing performance to your standards, which were established in the planning, and making corrective adjustments if and when necessary. Now that we've discussed what management is, now we can go into an analysis of how these different components are exemplified in the management case study for Partners Healthcare. So, Partners Healthcare is described as an integrated healthcare system with community and specialty hospitals, short and long-term services, and so much more. These different categories in management are exemplified throughout this entire organization, which I'd like to discuss. Planning is exemplified through their Connected Cardiac Care Program. They discuss what to do, which is help patients at risk for hospitalization and with heart disease, and how to do it, which is integrating technology into remote patient care and self-monitoring. They also describe their missions and their goals, which is coordination and education of patients and their development of self-managing skills. This was very important in this program because it helped patients who were at risk because of heart problems to understand their illnesses and ensure that and minimize their chances of being hospitalized yet again. Next, this organization exemplifies organizing through the way that it's organized through having community hospitals, specialty hospitals, community health centers, physician networks, and so much more. This exemplifies organizing because each of these services, healthcare services, can be understood as different departments and each department is responsible for ensuring that certain healthcare procedures and treatments are performed to the respective by the respective providers to the respective patients. I'd like to point out that I couldn't exactly find an organizational chart inside the textbook, but it really wasn't necessary, as throughout the textbook they describe very clearly the different responsibilities of each organization and how they try to improve them. Next, let's discuss staffing. They didn't mention staffing, clearly mention staffing, but they did mention what they're doing to retain their employees, which, as I mentioned before, is very important. This was exemplified by the way that they increased physician satisfaction by allowing them to notify them when they did not want a patient by allowing them to notify leaders when they did not want a patient in a program. What this did is it increased doctor satisfaction and the key goal, which was it reduced the refusal of care to patients from a whopping 10% to less than 1%. This was very important because not only were employees satisfied with the work, but it also influences the quality of their work. Less doctors were refusing care to patients, and patients were receiving the care that they needed. All that had to be done was catering to your employees' needs. And Partners Healthcare did a very good job of exemplifying that. Fourth, let's discuss directing. Directing was very well exemplified by this organization in the way that they assigned people work and the way they motivated them to do work, which I believe was very interesting. They utilized data to further motivate healthcare professionals to keep performing at their best. They mentioned that it embraced constant learning, and I'd also like to discuss how Partners gave the organization access to data and studies to compare and contrast the different data. What this did is it allowed employees to understand the level of work, the level of quality that they're at, and seek to improve, which is really important in directing, because again, it's not only assigning work to people, but motivating them to get that work done. And how motivating is it to know that you were so close, let's say in the last period, to do really well, to doing really good? Why not try keep pushing to go better this period? And lastly, controlling outcomes. This organization demonstrated controlling in management through the way that they invest, as explained in the textbook. They invest resources to be able to organize data to do that, to control their outcomes. This kind of connects to what they did with directing, but the key difference here is that I'd like to point out that it also helped facilitate they described that it also helped facilitate the development and implementation of other applications or programs. That's why the investment of resources into this database that allowed them to compare and contrast like their performance and information with other hospitals is important, because they said themselves that it helps them develop new projects and it helps them to improve they clarify that it increases their value and improves their quality care. This is important, in their words, to maintaining quality excellence. In addition to this, they adapt technology to improve operations, productivity, and patient care. This was my analysis of different components of management that are being exemplified in the management case study for Partners Healthcare.